For those that want to watch the streaming video, go to www.safetyleaders.org. And if your line is not fast enough, go back to the WebEx. For anyone that has interrupted service, we will be editing all of the video of the panels, and word searchable transcripts will be on the web within about 10 business days. Usually we do it within 2 days, but we have a whole day of transcripts, so we'll have those there. And I'm absolutely positive that this panel will be terrific, and I've been waiting for it because it's it is such an exciting time for us in healthcare. Earlier today, we had Jean Moody Williams, who's in charge of the quality improvement organizations through the federal government. And this year, which was just so exciting, they built into the agreements a $1 billion contract that the QIOs would have to start helping hospitals bring patients into the boardroom and into quality improvement, and that they'd have to reach out to trustees. And we think this is the same issue. And our goal ultimately is to move from where we're going to be with the panel today to have people, every one of the people that are here that are representing consumers on the board of directors, representing the hospital and actively governing our hospitals here in America and around the world, because this is critical. So I am so excited about this because I think we're starting to see a tectonic shift in healthcare. I mentioned earlier in our earlier panels about the physicians that 9 societies declared that there's overuse in testing and imaging, and that they want to go out up front and say we've got to do better care rather than defend the way we've been delivering care, which also means that we don't have to defend the way that we've been interacting with patients. And so my first person on the panel that I'd like to speak is Regina Holliday, and she's responsible for so many of these jackets, and I'm turning around in the press club and showing you how she tells her stories with beautiful art, painting them on the back of jackets. And we tried so hard to get Regina and a walking gallery in the movie that we are premiering tonight. However, they will be in the next movie, and we thought it was so important that you understand what Regina does in the current movie and how she uses art, and that she was a driver in a new program called SpeakerLink, which actually can link consumers to be coming into hospitals and in healthcare. So Regina, you've listened to a number of panels, you've been painting in the back of the room. What's your reaction? And if you had one message that you wanted to get out globally and to our national audience about patients getting into and being part of and a part of the leadership of what we do in healthcare, what would you share with us?
The most dangerous thing in healthcare are silos. People think differently, and if you bring multiple ideas and approaches to the same panel or institution, you change things. For instance, I am 5 foot tall. You might notice my legs right now. They are dangling. It is very challenging for a woman of my height to sit in a chair this tall. I wouldn't have designed this. So when you involve women, patients, children, diverse seniors, all different kinds of people to the table, it starts redesigning everything before we start investing money in it. So that's one element. The other thing is I have worked in medicine now for almost 4 years. And when I first hit this world, I couldn't believe a lot of things. One of the things is nobody was talking to each other. I made a lot of friends in what's called the HIT movement. Then I made a lot of friends in the patient safety movement. Guess what? They weren't talking to each other. They were having completely different conversations and often spending money on the exact same things, but not doing anything in concert. Now on top of that, within the medical community, the oncologists weren't talking to the people who worked in cardiology. The people who worked in pediatrics weren't talking to the people in senior services. So that was within medicine. Then you hit patient communities, guess what? The diabetes community is not talking to the cancer community, who is not talking to the lupus community, who is not talking to all the rest of us. And there's this decision to separate ourselves based on the idea that medicine is treating separate parts of the body, and guess what? We are one person. We are one people. And if we all start working together and spreading that information, we're going to change the world. So if there is number one thing, get rid of the silos.
Amen.
And we know as we study patient safety and we look at the fragmented care, and at the turn of the century, we didn't have too many specialties, and now we have 300. And we're trying to manage all this information, and we are having really fragmented care. Trisha is a very gifted person who I always love to talk to, and when I say, well, let's just have a quick 2-minute call, I look at the clock and I go, oh my gosh, the energy that she brings to the dialogue and her personal experience and how she became a champion for care and helped build a network of patient advocates who've helped me actually in, 2 or 3 states now, where I found people to help family members get through the healthcare system as she was building a network of, and has built a network of advocates. But share your story and why you are able to bring positive passion after a near tragedy.
Well, I don't want to spend a lot of time telling my story because we'd be here all afternoon, and of course I can embellish it as much as you'd like me to, Chuck. But may I just derail this for just a moment to say to you that I've been working in this capacity now for going on 8 years, and pardon me if I get emotional over this, but I feel like today is a huge, huge turning point. And you don't have any idea yet the change that you are making in people's minds about how they approach safety, and how it's no longer about technology, just technology, or as Regina said, these silos of information. The socio-techno, whatever that word was you used before, just the fact that you're recombining words is a huge, huge, I mean, it's unbelievable, and it gives me goosebumps, and I thank you for allowing me to be a part of all of this, and I thank all of you for being a part of it today as well. So my story is just briefly that in the summer of 2004, I found a lump on my torso that was about the size of a golf ball. Went off to my family physician, who sent me to a surgeon who removed it and exclaimed, "I've never seen anything that looks like this before." And that led to the next 3 months of me fighting my doctors, fighting testing, fighting all kinds of things just to get information, because they were telling me that I had subcutaneous panniculitis like T-cell lymphoma, and that my days were numbered. And I was on the golf course. And so somehow there was this disconnect in what I was being told and what the actual reality was. Eventually, I found a second opinion oncologist who got me my medical records. Now, this was huge. In 2004, patients didn't ask for their medical records. I just needed to look at them to understand. Well, of course, they were all in med speak and medicalese. I didn't understand any of it. I literally Googled word after word after word, including deltas. Did you know that you can Google Greek letters? So I finally came to the conclusion that I didn't have lymphoma. And of course, then the oncologist is laughing at me like, number one, I was a patient. What was I doing analyzing my medical records? And number two, they had 2 labs that independently proved it already, based on this biopsy. I eventually found an oncologist who was willing to send the biopsy to the NIH, to Dr. Elaine Jaffe, if any of you know anybody at the NIH, who reviewed this lump and came back and said there was no malignancy. And I've never had any form of treatment. And all these years later, I've never had another lump. And I've never had a diagnosis. And it changed my life. It literally changed my life, because not only had my trust, and we've heard that word so many times today, had my trust totally flown out the window with the system that I thought was set up to protect me and take care of me. But the other thing it did was it cost me every penny of my savings. And at that point, I had to ask what on earth had gone on. And because my background was all in marketing, and prior to that I'd been a school teacher, I realized, and spiritually I believe that everything happens for a reason. I had to take my skills and start talking to other people and see if I could get the conversation going about what had gone wrong, because then I started hearing stories from everyone else. And so if there were messages that I want to share with all of you today, it's number one, as we talk about this, let's call it collision for a moment between HIT and patients, we can help. And the gentleman earlier who said he's now got 1,000 fact checkers, that was why we were clapping. I was the fact checker.
Yep.
You know, had I not checked the facts, what if I'd gone through chemo? What if it had resulted in a lawsuit? I mean, you want to talk about what that would have cost the system, and it already cost me every penny I had. So let us be those fact checkers, include us.
What a great point. Yeah, and I think that we're starting to see the tide turning towards
Absolutely.
realizing that we're not seeing increased lawsuits. We're not, what's the threat other than Warren Buffett's line that I just love, the chains of habit are too light to be felt until they're too heavy to break.
Ooh, that's a good one.
And those chains of habit are pretty hard to break.
Well,
We
it's
talk
just-
about,
let
I
me
went
just-
up for time though, I just want to make sure, because we have a longer panel,
Okay.
we'll come back to you, Trisha, but
Okay.
Mary and Ellen, you both are nurses. This panel is about our patients. This is about the patients. It's about the dialogue that we just heard. Our nurses feel like they're hostages at the table. They would like to give more information. They do want to have, many of them want to have the patients to be more part of it, but they feel, we've both had, the three of us separately have had this conversation of how they feel unempowered by the leadership that are leading it up at the hospital to be more fully engaged with patients in a more equal way, and they would love it, but they are afraid. What advice? Let's go to Ellen and then Mary, because we've heard. Okay, Mary, go ahead. Okay.
Because I say that because she's done a lot of research on this subject, and I think would offer the audience some insights.
You're
that way.
being a good trustee. See, she's a hospital trustee. She was governing. Go.
And I know Ellen has some really great points to make, so I won't step on that. So I'll respond to what nurses are thinking and feeling as best as I can as a previous frontline nurse, chief nurse, safety officer, and now a researcher in the area of quality and safety in hospital care. And this is not just about hospitals. Our health systems need to be safe, whether you're in the community clinic or in post-acute care, and if you're lucky, you never make it to the hospital. But all of our health systems need to be safer. Nurses are struggling. And I think it's a reality that there's a production model in place in many settings. I resonated with the Lucille Ball funny moment of trying to stay ahead of the chocolates coming out of the chute. And you mentioned, and it was even a quote in there saying nurses dread the moment where they say, do more with less. Resource allocation.
I wrote that in because I've shown that to 25,000 people, and every nurse
That's
is
right.
laughing and then kind of like,
Yeah.
they laugh and then they get sad.
That's right.
Yep.
So, nurses are struggling with this productive model and are trying to keep abreast of all the technology, the latest meds, the equipment, the EHR that isn't working well, the barcoder that's broken today, the electronic record that nobody really taught everybody how to use. I mean, I thought the points about good HIT and not so good HIT implementation was very important for folks to hear, particularly those buying these systems and putting them in place. So they are struggling. They do want to be active caregivers and partners with patients. And I think they're just looking for the ways to learn how to do that. We're told, I said this earlier, but I'll say it again, we're told to be patient-centered, but we're not really explained or shown the way on how that is actualized.
And they really do want to create
They do.
a dialogue.
Yeah.
The dialogue, we heard two people say, we want to have dialogue, fragmentation, bring it together. We can be an active fact checker. I'm going to go now to Ellen, and we've talked numerous times about figuring out how we can create a track for nurses to get on boards, because they know what we're hearing here, and people in the community don't. And if we could get a nurse on every board in America, things would be different if they were listening.
Everything. I can tell you that.
It really would. React to that, and we've
Well,
talked about that, and that's a
I think
important
most
issue.
people don't realize that there's only about 7% of boards of trustees in the United States that have a nurse on board. And I would urge our listeners, and certainly anyone in the audience, to join the trend of adding a nurse expert on the board. Now, when I speak with people about this, they'll often say to me, oh, well, we have a nurse on the board. The CNO is the nurse on the board. And I say to them, with all due respect, that a nurse on a CNO of a board is not going to turn to Dr. Toby Cosgrove
Speak
and
truth
say,
to power.
Dr. Cosgrove, I don't think you're, correct on that. So the nurse trustee brings a different voice. She can, or he can, translate things. And I think the two things that a nurse trustee brings are, one is they see care through the eyes of the patient, because they are educated to be the patient's advocate. They are the most involved with the patient minute to minute and hour to hour. And in terms of quality and safety, They are the icon for quality and safety working with that patient and family.
We believe this is so important that we're starting a training program for nurses to track into governance, because we think it's really important. We think that even governance advisors, knowing how to work with a board, they rarely go in this area, and then they don't understand the vocabulary and the business approach, and yet it's just like learning another specialty.
I just wanted to make one comment about, you heard the physician trustee this morning. Nurse and physicians that move over to being a trustee, they have this similar learning curve issues. They know the business, hopefully, but they have to learn a different culture in a boardroom, the business side, and so on. But there are efforts to move and to transform people.
So we have
in boards
1.6 million nurses in America, and globally, just do the math of how many are caregivers. We see them hostages at the table where they'd like to have the dialogue, but they feel constrained by the legal issues and the business issues and the production issues. Lygeia, tell us what your role is at the Office of the National Coordinator, and how that intersects with the patients and bringing the patients into this IT moment.
So I'm at the Office of the National Coordinator for Health IT, and I run our consumer e-health work. It's very exciting that we had a program for the first time, which launched last fall, which is specifically about bringing consumers and patients into this push to develop health IT and encourage its adoption around the country. As I see it, our role is not to lead this effort per se, but to harness the energy to catalyze the change that's already going on, both as a result of changes in the healthcare system, like payment reform, but also some of these outside forces that we're seeing, patients like Trisha and like Regina who've become very activated, and certainly nurses who believe in this viewpoint, but also technology changes. The world is radically different today from what it looked like 5 or 10 or 20 years ago in terms of technology. I mean, as an example, look at that screen over there. We're looking at a tweet stream. That wouldn't have been there 2 years ago, never mind 5. And so the rate at which technology is changing is really impressive, and that is constantly shifting our landscape in a way that moves us toward greater patient engagement and empowerment politically and in their own health and healthcare. So our job, my job as I see it, is to harness some of those energies, make partnerships, catalyze, and let this all kind of bloom forward in a way that really benefits patients and the system.
And really to put a sharp edge on it, our demographics are our destiny. The people that are on that stream are becoming the caregivers of those of us that are aging, and we're expecting democratization of information. They don't understand lack of access, and they understand, why wouldn't there be a health exchange where I could see what it costs for the operation,
right,
and then the guy's outcomes and process measures? And why wouldn't they? They do it for restaurants. They do it, I take my smartphone and I know everything about that. Why don't I have that? And the U.S. News and World Report, why isn't that right here and helping guide me to it? And they will become the new payer, ultimate payer, because they're going to be caring for the elderly. My wife does a wonderful job caring for my mom and helping her through the process, and she's much more wired than what we would be 5 or 10 years ago. I want to, because of time, I want to come to Nancy, and I want to take a totally separate issue, Nancy, because you and I have had a history together. I think that another part we don't talk about is when we lose a family member, when a harmful event occurs, and this big body of patients and families who would like to come and help hospitals. We know that the quality improvement organizations now are given the charge to do it. We know that the progressive hospitals are doing it. We know that it doesn't increase lawsuits. You don't hear of the train wrecks that everyone's afraid of. Doesn't happen. But there are two groups. There's an A group and a B group. There's the A group that are going through Kubler-Ross's stages of grief. They're going through denial and anger and depression, bargaining, and acceptance. They're going through these stages, and when they're going through that, they really, Nancy, after Pete died, and we got together, we together went through A and B, right? We went through the times when you were angry and when you hurt and when telling the story made it feel better, but we also went through the times when reliving the story really hurt, and it opened up an old wound and it made it harder. And it's happened with Sorrel King, who was in our movie, happened with Sue Sheridan in our movie, and it has happened with Steve Rell in our first movie, and it happened, with you. Now, We need to have sensitive care. There's some of the greatest hospital organizations in the world are in this room today, and they can really help us study how to deal with A and B. Because I see A and B in a room. We've seen this at a national meeting 2 years ago where people fussed because the A group undergoing the healing process thought that the other group didn't care that my daughter was killed. And the B group said, look, I'm fit to go serve, but we've got to be positive. Yeah, but my daughter or son was killed. And we need to be sensitive because this is a psychological emergency. And I think when Pete died, you went through both A and B in a wonderful way that led to lives saved all over the country because of the talks that we gave together and that kind of thing. But help put a finer edge on that for us to understand what it is to be in that space.
Well, I suppose one of the most important things that you and I worked on together, and there were many, was disclosure. And those 3 pieces of it, tell me what happened, tell me what you're going to do so it won't happen again, and could you just say you're sorry? That does just, then you don't have to go through all of this because you're working together to transition both the hospital environment. So they're listening, and they've taken the leadership to disclose, and that's huge. And that helps the victim, God, I hate even using the word, but it helps the person who gets left behind to understand that at least the hospital's taking responsibility. There's some leadership there, that they're going to import a system so this won't happen again. And that really takes the whole thing to a whole different level.
So it would be improper to talk about any event, which I won't. I'm going to talk hypothetically, though. Nancy, if there had been an NTSB report that said, here's how this kind of circumstance from the experience you had, a report could have been written. Or I know Dennis Quaid, who really wished he could be here. He's on a movie set and he's flying all over the globe, and he really wished that he could be here. But he says that if a report had been written 11 months earlier about the accident in Indianapolis, that it wouldn't happen to his twins. And why didn't one happen after his accident with his twins? Because it happened again, and it happens again and again. Would that have been a healing thing for you to know that, would that have been a healing thing that would happen to Fred? To know that a report prevented the suffering that occurred to you, Regina?
Speakers did it specifically for that reason, that if you're not going to create a report for us, we'll just go and talk all over the nation and create our own report.
Yeah.
Right.
And in some cases, the painting.
Yeah.
This is absolutely true, and this is the other thing that I wanted to say earlier, and that is that for any of us who have been harmed by the healthcare system, and I don't, I can talk about any harm, what I hear from patients, and I hear from dozens of them every month who have suffered something, or I hear from their family members, every one of them wants to know that someone will be better off eventually
Absolutely.
because what they have suffered. And if somebody can say to them, you know what, you telling that story will influence somebody else's life in a very positive way, then forgiveness begins, healing begins.
Healing begins.
And bringing those people into your boardroom. I've written about the 6th stage of grief, which I call proactive survivorship. Those are the people who've been through the 5 stages and now take whatever it was that took them through that into a positive for other people. The best example I give is the Mothers Against Driving. That mother, whoever she was a proactive survivor. That's the 6th stage. Those are the people you want in your boardroom because they will make an incredible difference.
So now, applause, absolutely, we should applaud that. Good job, Trisha. So what are the good stories? Are there good stories of bad event, patient, advocate getting involved, translating into positive impact, and giving meaning to harm? And I think that Jenny's an example of that, because Jenny, every other Saturday morning, 7 o'clock Pacific time, Jenny and about 6 or 7 of us are on the phone talking about what we could do to create moments like this moment here. Jenny is a co-author of medical articles, more than one, and that's why it says author at the bottom on the movie. And Jenny has been an advisor to HRSA, and I know Paul Moore is here from HRSA, and I know the head of the agency is a wonderful person that was hoping to be here as well, Mary Davenport. But Jenny, you know, you've been able to turn the negative energy into positive energy, and you are kind of one of those behind the scenes comfort person to others that have gone through the event. Has that had meaning for you to take what happened to you and the other people to have impact on others, and would you recommend that?
Oh yeah, I highly recommend that. I've been counseling with folks who experienced medical error and other outcomes that were poor through healthcare, and either through loss or injury to themselves or a family member. And through the years, I've connected many people together with other like-minded people, and they have developed great relationships. For one, a child was lost by one mother. I put her in touch with another mother who lost a child in a similar way. That second mother convinced her to have a second child, and it was able to help her heal. So little things like that are really, really important. But most importantly is I've learned so much from all of the people I've counseled through the years. And we go through experiences from the cradle to the grave in healthcare, but we also go through the cradle to the grave starting with our primary care physician all the way through anything that we do, any specialty that we receive. And it is imperative that patients and families be part of the big picture, that they're true partners, that they're able to communicate freely and not be afraid to talk about things with their providers. And it's important that we have a well-rounded group caring for each patient in this country, particularly with our aging generation that we have right now and others taking care of them. We can no longer depend on the healthcare industry to do everything for us. We must educate ourselves.
Ellen.
Address that same issue, and it is, Chuck has taught us all that it's good to get information through to people by telling stories. So I'm going to tell a story on two people that are here in the audience, and that is I attended a meeting of 300 executive nurses in the state of California, and they're brought together to look at all the same issues that we are. And one of the major sessions was led by Mary Foley, Dr. Mary Foley, and she, instead of standing up and giving data to these 300 nurse executives, she brought Karen Curtis, to give a presentation similar to what we are hearing about. And Karen also is a national speaker. She had 3 family members with cascading incidents, and went through the stages of grief and anger and acceptance, and took her experience. And so she stood up and gave a presentation about all of this, and then announced a book that she had written called Safe and Sound in the Hospital. And this is a checklist for family members and caregivers of patients. And it's practical. It's things that every single patient and caregiver should know about to work with the nurses on quality and safety. At the conclusion of her speech, one of the nurse leaders stood up. People were just breathless at what she described. And this nurse stood up and said, on behalf of all the 300 nurses here in this session, we apologize to you and your family for what happened to you. And people were in tears. And I think it was a very powerful message, instead of having Dr. Foley give statistics. Anyway, so I stood up, moved by this, and of course you can tell being shy and quiet, and said that I really wanted to harness all these nurses to help get more nurses on boards, and also to work more closely with patients with a true partnership. Not partnership for patients, partnership with patients.
But that, and the reason I could do that, the reason I had no doubt about the right thing, was having worked in this kind of partnership with patients and families and health leaders and policy leaders to make the difference happen. So it was natural for me to say, because I've been on these panels and been a partner with Chuck and folks here on those Saturday calls, but more importantly, telling the stories. And it was a natural, and so I'm really proud that this is a patient and family partnership.
So what I want to conclude with is come back to Nancy. Had Nancy not stood up at podiums all over all over the country, podiitis, and declared this disclosure issue. The pain of disclosure, I wouldn't have been as motivated to work on a National Quality Forum disclosure practice, and then we wouldn't have written an article that you two and all of you were involved in that actually was the evidence that pushed it over the line, and it all started there, just like the walking gallery all started here, and people don't realize how catalytic that these things are. So I'd like all of you just to help me thank this wonderful panel, to know that this is not a token panel, this is tomorrow, because I think we're at a point where this is the new leadership that we're going to have that's going to be the pull-through, because our system's broken.
And one last thing, I want to make sure people know how brave this woman was. She didn't tell the conference that she was bringing a patient with her. She just did it.
You just did it.
So you do that too.
Thank you very much.